Good afternoon, sir. Good afternoon, everyone. Welcome you
Good
all for
afternoon.
welcome you all for Facebook Live. Topic of today's session is diabetes and social drinking. Sir, now my first question to you is, why did you choose this topic for the day?
I think this is one of the things, one of the aspects of lifestyle which is very rarely, discussed at all. And it is a common day-to-day issue in most of the people's life who have diabetes or who have people with diabetes in their families. Now, gone are the days when social drinking or drinking in a party was a taboo. I still remember 20 years back or maybe 25 years back, if there was a function and somebody had to drink, you had to go behind the tents and in the corner there was a small shabby place where everybody is drinking like as if you are getting something which you will not get anywhere else. Now things have changed. Drinking, social drinking has become part of culture, part of day-to-day life. And this is something which becomes a challenging situation for people with diabetes, as is, what to eat, what not to eat. So it is as common as that.
So
But
today,
but fortunately or unfortunately, this topic is not discussed by the treating physicians also, and even the people who have diabetes or patients and their family members, they also have apprehensions. So most of the time when somebody comes, the spouse will say, usually it is the male person who consumes drink, and the uh, wife will say, "Doctor, please tell him to stop drinking." You know, this is the usual thing, and I think these things need to be clarified both for patients and their families and their caretakers, so that it is not a challenge. It is not a difficult thing to manage. And this is a common thing. Suppose somebody has a good lifestyle, wants to have a social, meet people often, is socially very mobile, and taking just one drink or two drinks, makes his life better, quality of life better, then we have to make sure that we are not compromising the quality of life. Whatever disease, whatever chronic disease is there, I think treatment has to keep an eye on the quality of life also. People who are having disease process like diabetes or heart disease or obesity, they have to live with these diseases for rest of their life. And we have to make sure to offer them as good a quality of life as possible while managing the disease. So I think this is very important, and that is why I chose this topic.
right, sir. So today we will try to clear all the doubts regarding diabetes and social drinking. So my first question to you for the day is, you were talking about social drinking. What exactly do we mean by social drinking?
Yes. So first thing is, what is social drinking? So I have actually I'm going to share my screen and show you some slides. Are you sharing your screen?
No, sir.
Okay, give me a second. So first thing is, what is social drinking? And social. I picked up the definitions from dictionary. This is Collins Dictionary. Says the social drinking is defined as practice of drinking alcohol occasionally. This is in bold letters, and usually only in the social situations, right? This is what is meant by social drinking. Now, what is the situation in the Western world is that most of the social drinking takes place in or just after the office hours. It is very unlike in Indian setting, right? There people will end up finish the office and have a drink. People have option to drink within the office also, office premises also. or they will, just move out of the office and get into a pub or something, have a drink, and then go home. So usually the social drinking happens immediately after the office hours or within the office hours. While in India, situation is very different. Nobody is, allowed to drink in the office, and it is considered bad. In a way, it is good also. And immediately after the office hours, now it is coming up. It is becoming more and more common with the, kind of new work culture that we have. uh, People end up their offices and straight away head to the pubs and have a drink and food and then come back. So we are moving towards that direction, but usually social drinking in India means that whenever we are getting together for a social occasion, or just visiting a friend or relative, or somebody is visiting us and we have a social gathering, then that is the time when somebody is drinking, and that is what social drinking would mean in Indian context.
Right,
But
sir.
the important thing to focus is that drinking alcohol occasionally and usually in social situations. Okay, so that is social drinking.
Right, sir. So how do you define a standard drink?
So that is another very important thing, that when
Yes.
we say, you can take, some people will come and say that I take only two drinks or one drink or three drinks. So we should know what is a drink. So one standard drink is equal to 14 grams or 18 ml of pure alcohol. So 14 grams or 18 ml of pure alcohol, which is equal to about a small, the pint of beer, which contains 5% alcohol, or malt liquor usually is not frequently consumed in India, but it's about 7% alcohol, or 5 ounces of wine, that is about 150 ml of wine, which contains 12% alcohol, or 1.5 ounces, which is about 45 ml of 40 80% proof, which is hard liquor. Any vodka, rum, whiskey, all these are 40% alcohol. So one pint of beer, that is 350 ml beer, or a 150 ml wine, or a 45 ml drink. Now, one thing you have to keep in mind here is that all these figures are based on the recommendations by Center for Disease Control in US, and these are for the Western population or Caucasian population who have a heavier body structure and heavier body weight also. So in India, it is generally considered that these amounts should be lower. So the standard drink should be about 30 ml. And this is what is the serving size also in most of the restaurants or hotels in Indian setting. The standard drink, hard drink, is considered 30 ml. So that is what is the standard.
So, so,
And yeah.
sir, is it okay for a person with diabetes to take alcohol and all these type of standard drinks?
So most of the time it is okay as long as person is drinking in moderation. So the guidelines are that person should consume alcohol only in moderation for diabetes patients. For everybody, actually, the guidelines say that you should have moderate alcohol consumption. So what is meant by moderation? So moderation is also important. We should know what is the moderation recommended by various guidelines, and most of the data again is based on the Western guidelines. But you can translate that, one drink for India, you should consider 30 ml rather than 45 ml of hard liquor. And moderate alcohol consumption is defined as up to having one drink per day for women and up to two drinks per day for men. And this again has possibly to do with the higher body weight and heavier body size for men as compared to women. And this refers to the amount consumed on a single day and is not intended to be average of several days. So it is not that you consume 14 drinks in 2 days, and you say I am taking 2 drinks every day, right? So it is any day you should not be consuming more than 2 drinks if you are a male, or 1 drink if you are a female. That is what is moderate alcohol consumption. However, one thing should be very clear, that no dietary guidelines recommend that people who do not drink alcohol should drink or start drinking for any reason, because alcohol has addiction potential, and people who are not consuming alcohol start alcohol, they are predisposing themselves to a potential addicting substance or substance of abuse, and it is not to be initiated unless person is already having alcohol.
So this moderate alcohol consumption you're talking about, does it have some advantages also?
Yes, so there are studies which have shown that moderate alcohol consumption can offer some health benefits, which include reducing the risk of developing heart disease as well as death from heart disease. But the consumption has to be, less than 2 drinks, or for men, and 1 drink for women. That is how, these figures of 2 and 1 drinks have come up, because the various epidemiological studies have shown. There was a study called Interheart study, which showed that consuming that much alcohol, up to that much alcohol, was associated with reduced risk of heart disease, developing heart disease, or death from heart disease. Similarly, there is a reduced risk of developing brain strokes if you are consuming only that much alcohol and not more than that. The cutoffs are very clear. People who consume more than this, the risk goes in other direction. There is increased risk of dying from heart disease. There is increased risk of strokes also. And there is some evidence that there is reduced risk of developing diabetes also if you are consuming only moderate alcohol.
So my next question to you will come to excess alcohol. How does excess alcohol consumption affects the person with diabetes?
So alcohol basically is a substance which has a lot of toxic effects in body, or has damaging effects in body. Now these toxic effects are seen when we say there is person is consuming excess alcohol. So excess alcohol is heavy or high. This is defined as heavy drinking or high risk drinking. And this means that if somebody consumes more than 3 drinks on any day, or more than 7 drinks for in a week, which is for women or men above 65 years of age, and more than 4 drinks on any given day, or more than 14 drinks a week for men less than 65 years of age. And if that is the consumption, it is definitely going to harm, right? And this is considered, actually this is considered heavy drinking or excess alcohol drinking, right? And binge drinking is that you consume more than 4 drinks on any given day. So this is binge drinking. Both can be harmful. And in fact, if you look at this picture, it can have bad impact on practically every part of the body. It can lead to impact on the visual acuity. Person can have an impaired vision, can lead to amblyopia, which is impaired vision. It can lead to impaired brain function. It can lead to increased risk of cancers. It can lead to bleeding from stomach, throat, irregular heartbeats. It can, in due course of time, it can damage the liver, lead to chronic liver disease, which ultimately becomes fatal. It can increase the risk of number of cancers, can increase the risk of osteoporosis, and acute effects. It can lead to bad behavior on part of the drinking person, uh, uh, poor, controls while driving, increased risk of accident, increased risk of falls, increased risk of getting into arguments and fights, uh, poor social sense, loss of social skills for the time being. So all these things can happen. So in excess alcohol is always bad. What happened? Okay. Now, specifically when we talk about diabetes patients, then alcohol can worsen the risk of hypoglycemia, low sugars, because alcohol suppresses glucose production from liver, and there are medications which suppress alcohol glucose production for liver from liver. So if somebody is consuming more alcohol or excess alcohol, actually can develop very low levels of sugar, which will be difficult to reverse also after giving glucose. Second thing is the ongoing excess alcohol consumption can damage the nerves, can damage the eyes, can damage the functioning of heart also, and all these are damaged by diabetes also. So it can worsen the diabetic damage in people where the consumption is more than moderate alcohol consumption.
So we are talking about the disadvantages of excess alcohol. Let's talk about just alcohol. How does the alcohol affects the blood sugar level?
So alcohol is basically empty calories. So if you are consuming excess calories, ultimately it is going to add on to blood sugar. But as I mentioned, at the same time, it leads to suppression of glucose production from liver. So it can lead to a precipitous fall in the glucose levels. So somebody is consuming excess alcohol, and then when people are consuming more alcohol, they tend to either eat more, or some people will not eat much because they are consuming more alcohol. So both the situations are bad. If people are eating more, they are consuming excess calories, they are consuming more alcohol, they are getting increase in blood sugar levels. People who are consuming less are at risk of going into very low sugar levels. So, and second thing is, what people generally do is when they are consuming alcohol, they tend to skip their medication. And this is based on the understanding that since the medication may have interaction with alcohol, it is best not to take medication and take alcohol. The understanding is not that best not to take alcohol and take medication, it is otherwise. So you tend to skip medication, you tend to deviate from the recommended dietary habits, you tend to, predispose yourself to fluctuations of glucose, which can be on either side. It can be high, it can be low. Now, if you consume more food and more alcohol, the chances are you will get into a high glucose level, and that will take couple of days to come back to the normal baseline. If you are not consuming enough food and you have taken excess alcohol, chances are that you can end up in very low sugar levels and become unconscious. And if you are, if immediate care is not available, a person can lapse into a significant unconsciousness and damage to brain also. All episodes of hypoglycemia tend to produce some impact on negative impact on brain functioning also. So getting into hypoglycemia is never a good idea, and that is why it is to be kept in mind that somebody is consuming alcohol, then chances of hypoglycemia will be high.
So, sir, my next question will be about the monitoring of blood sugar levels. How important is it, and how to monitor your blood sugar levels?
So there are, monitoring is very important. Person should know his glucose level once the person is going to a function or going to have alcohol. Before that, person should make sure his glucose level is normal or at least near normal. And if it is on the lower side, person should take some fruit juice or food before person goes for consumption of alcohol. If the sugar levels are already high, person should know that he has to eat limited amount, or if there is a change in medication required as advised by the treating physician, person should do that. Now, second thing is, after meal also, before going to bed, person should check the sugar. And if it is on the lower side, person should consume some food or take a glass of juice or soft drink before going to bed so that the risk of hypoglycemia is reduced. So chances of, because there are chances of fluctuations in glucose levels, it is very important to make sure that it is very important to monitor glucose levels before as well as after consumption of alcohol, and more frequently during the day before and day after the alcohol consumption, so that you know how your food intake, change in food intake or alcohol intake impacts your glucose levels.
In the initials, you said one thing, ki usually the wife or the partner has a lot of apprehensions and queries about the alcohol consumption for the person with diabetes. So, what do you suggest? What's your take on this situation? Ki a person who is suffering from diabetes and he is into social drinking, should he or she stop it?
So, okay, as I mentioned, you know, earlier also, okay. So, as I mentioned earlier, the people who do not take alcohol should not start taking alcohol. And this is the general recommendation because there is a addiction potential. But somebody who has a stable, alcohol intake over few years and is only taking alcohol socially, or is a moderate alcohol drinker, like somebody, there are people who have a habit of taking one small drink every evening with meal or whatever, then there is no harm in continuing. If that single drink or that social drinking helps the person in maintaining or having a good quality of life and good feeling, then there is no harm in continuing with that. It is not going to harm. And there are studies which have shown that if you are consuming moderate alcohol, then it may be beneficial in terms of reducing the risk of heart, stroke, and the risk of diabetes also. So there is no harm in continuing that. But if it is moving towards binge drinking or excess alcohol intake, certainly it is not advisable, because not only it is detrimental for overall health, specifically in diabetes, it is likely to worsen neuropathy, cardiomyopathy, visual, problems, brain function. Everything can have a negative impact. So, problem happens when person is taking, say, only 2 drinks a week, and or 3 drinks a week. There are people who very commonly we see is that who will take a drink Wednesday and Saturday, who will take a drink Wednesday, Saturday, and Sunday, right? If they are consuming 60 ml, that is fine, or 45 ml, that is fine. Why do you want to, uh, change their lifestyle when they are happy with that? But the reason why the spouse, usually here it is, the wife, because in India somehow most of the wives don't drink and the husbands drink. That is the situation. It is not the other way. In Western world, everybody drinks, so it doesn't matter, who's telling about whom. As long as you are taking in permissible limit and it helps in maintaining a good quality of life, I don't see there is any reason to tell them to stop it. On the other hand, most of the people don't complain about smoking. The spouse will never, wife will never tell that he smokes, so you have to tell him to stop smoking. She will tell that you have to tell him to stop taking alcohol, but she will not tell that you tell him to stop smoking. Smoking is more acceptable as compared to drinking, while it should be other way. Every single cigarette smoked causes harm, and smoking is totally no for any individual with or without diabetes. It does not give you any benefit whatsoever, whether you have diabetes or you don't have diabetes. With alcohol, at least you have some studies which have shown that it may be beneficial as long as you are taking in moderation. So where is the problem? But people don't bother about smoking, they are more focused on alcohol. So I think that you have to make them understand that if, as long as it is limited to social drinking or maintained within the defines of moderate alcohol intake, one can continue. Only thing is, one should be clear that once person is taking alcohol, should not skip medications, should check his sugar more frequently, and consume enough food that person does not get into very low sugar levels. These are the simple precautions one has to take.
Right, sir. So, but usually what we see in diabetes is obesity, fatty liver, LFT, slightly maybe deranged. So, what's your take on? Do we need to monitor all these things also before we
So
advise?
if you are consuming in moderation, actually it does not cause damage to any of these. The very clear cut definitions of moderate alcohol consumption are there. So if you are taking that much, actually it does not cause much problem. But the problem is that it is adding to calories. So somebody is obese has to make sure that more focus is required on regular exercise, a healthy eating pattern, and focus on weight reduction, not on what person is, how much alcohol person is consuming. As long as he is consuming, say, 60 ml maybe twice a week, and with that he feels good and he can maintain the dietary pattern during rest of week and maintaining a regular brisk walk of say 1 hour every day, there is no problem. As long as person we are taking care of all other aspects of lifestyle, then this is not going to harm. That is what the evidence is till now. But if you go beyond these limits, certainly it is a no. Then one should stop. And there are people who will come, sir, मैं 2 ही दिन पीता हूँ, but कितनी पीता हूँ? Sir, 1 quarter. 1 quarter means 180 ml, which should be the weekly consumption.
So, there's one more aspect which I would like to discuss, that during this COVID period, what we have seen is a myth has been circulating कि alcohol destroys the virus in the oral cavity and maybe the inhaled virus also. So, how do you take on this? What would you advise to my
I
audience?
will, yes, I will show you some very clear cut guidelines which came on this. To begin with, uh, the basic concept came that you should use alcohol sanitizer and clean everything with alcohol. So alcohol is there in liquor, and people started thinking, since alcohol is killing virus, so why not consume more alcohol also? And that is how the whole story came. But there are a couple of more points which I wanted to touch upon. uh, one of these things that happens is that people, once they get diabetes, there is a diabetes distress also, which we have discussed earlier. And because of this stress, they may move towards alcohol or increased alcohol consumption, because as a coping mechanism for tackling stress. But one has to keep in mind that it is not a good coping mechanism. Consuming more alcohol does not help in coping with stress. Actually, it can lead to increase in panic, increase in anxiety disorders. It can worsen depression or other mental disorders. And of course, as I mentioned, there is risk of family and domestic violence if there is or social violence also, social bad behavior also. Somebody is consuming more alcohol. And another important thing is that people in India and worldwide, everywhere, people drink more beer also. So beer, depending on what kind of beer they are consuming, there are extra calories in beer, and that can lead to increase in the sugar levels. So one should be clear what they are taking and how many excess calories they are taking with that. And that is why beer is generally, instead of though the if we convert from the alcohol basis, one may be able to take 2 pints of beer, but it is best to restrict to 0.1 pint, because then you are going to add unnecessary calories also. Now coming to the COVID situation. This was, WHO regional office in Europe, which came out with this clear-cut recommendations on COVID and excessive alcohol consumption, because of this myths which was circulating that increased alcohol consumption will, help in destroying the virus. And the myth was that consuming alcohol destroys virus that causes COVID. And the answer is clear that consuming alcohol will not destroy the virus, and its consumption is likely to increase health risk in a person if a person becomes infected with the virus. Now, another myth was that drinking strong alcohol kills virus in the inhaled air also. And consumption of alcohol does not kill virus in the inhaled air. It will not disinfect your mouth or throat, and it will not give you any kind of protection against COVID. So this should be very, very clear that it does not help in reducing the COVID risk or COVID, severity. Now, another myth was that alcohol stimulates immunity and resistance to the virus. And again, it is very clear that alcohol actually has a negative impact on your immune system. If you are consuming excess alcohol, it will impair your immunity, and it will reduce your viral resistance, and the chances of infection will be high. And again, reiterating what I said, smoking is strict no. Alcohol in moderation may be okay, social drinking may be okay, but smoking is no.
So smoking is a big no from your side, sir.
Not from my side. It is that is what we have learned from what we have learned from science.
So do you suggest that even if you rarely drink, if you are a person who is suffering from diabetes, you should discuss it with your healthcare worker? You should know your limitations. You should know your drinking and medicine interactions.
Can you still see my screen?
Yes, it's there, sir.
Okay, okay. I know something has gone wrong on my this thing. Anyways, doesn't matter. Yes. So, can you repeat your question,
Yeah,
please?
sir. So my next question to you is, if you are a person with diabetes and you are a very rare drinker, you means not even social drinker, a very occasional, a very rare drinker. So do you need to discuss it with your healthcare worker?
Ideally, you should, because healthcare person, whoever is taking care of health, will be able to guide you better in what you need to do with your alcohol habits, and uh, also that what kind of monitoring is required, what medications you are on. There are some medications which are more prone to cause hypoglycemia as compared to other medications. So if the risk of hypoglycemia is low, then your frequency of testing may not be that much. If the risk of hypoglycemia is high, then maybe you need to test more frequently, you need to take more precautions. So it is always important to discuss all these things with your treating physician or nutritionist.
So my last question to you for the day is, what any do's and don'ts for the social drinking and a person with diabetes?
So do's and don'ts is, first, if you don't drink, don't start drinking. That is the first thing. If uh, you have the habit of social drinking or moderate alcohol consumption, as long as you are able to maintain that line, that well defined line, that you don't cross that line, it is okay. But at the same time, it becomes more important to keep monitoring your glucose levels more closely, and keep your health checks, regular health checks at periodic times, to make sure that you are not coming in harm's way. And smoking is, of course, more important, that you should stop smoking means stop smoking. No binge drinking. People think that I drink only once in 3 weeks, so I can take 4 drinks. No, strict no, because that can cause more damage. So it is very clear that as long as your drinking is limited to social drinking and moderate consumption, it is good for your lifestyle. It is fine. If you are crossing your lines, strict no.
There's a question from our viewer. Can I take the question?
Yeah, why not?
In view of gross health hazards and addictive properties, should alcohol in any quantity must be discouraged instead of clean it for a meager quantity?
Instead of a clean sheet for?
Meager quantity, small quantity.
No, but I think I tried to make it very
Yes,
clear
we have given the
that
answer, sir.
if you are consuming within the defines of moderate consumption, it has not been shown to cause any harm largely. Now, you this limit has to be respected
Yes.
and maintained. If you are going beyond that, or if you have a tendency to cross that line, it is better to stop it.
Perfect. So anything you would like to add more to the session which I have not covered or you would
No, I
more like
think,
to focus
Kirti, we
on?
have covered almost all the important points, and I think I have made it very clear
Yes.
that social drinking in moderate amounts does not kill a diabetes person, or for that matter, any person, and doesn't lead to increased risk of complications or anything, and can be continued if it is already existing in a person who gets diabetes, but it is not to be recommended as a part of improving lifestyle as or to be initiated. If somebody is consuming more than this, it is better to stop drinking. So it is very clear that social drinking in moderate amounts, which are very clear cut defined lines, and we have discussed that, is permissible. Nothing beyond that is permissible.
Actually, sir, with changing time, the society is changing, everything is changing. These topics we need to talk about. We need to come up with such sensitive issues.
I
And we
think
have
it
to
is
take it in a
very
positive
important.
way.
It is very
Yes.
important. See, somebody is working in a high profile job and has to, socialize. There are daily marketing meets. There are, meetings with the different company people. There you are meeting in conferences, and you are joining people for dinner, and you'd feel kind of restricted because of lack of information. So if you have clear cut information, you want to have a glass of wine and socialize with people. Some people feel that can they just hold the glass of wine? They will not drink. There are people who don't drink, and they would like to carry a glass of wine and keep mixing with people. And at the end of the day, they will leave that glass just like that. But it makes them more comfortable, more confident interacting with people. So why should you miss on that if it is not causing any harm? Only thing is you should be informed about it, and you should know how to handle it.
Yes. Perfect, sir. So, sir, that brings to the end of the session. Thank you, everyone, for joining.
Thank you, everyone. Thank you so much, and hope to see you again on next Thursday, 3 p.m. Hope you are enjoying all these discussions. And if you have any suggestions, you can always post on our Facebook page. Thank you.
Thank you.